meniscus. It's called the medial compartment. That's the femur bone above, which is absolutely beautiful. The tibia bone below, along with the lining called articular cartilage or hyaline cartilage, and then the meniscus. The meniscus is a little tiny little pad right there. So small, yet so important. And we look at that. So what I'm doing now is I'm making sure that I'm not missing anything. Meniscus looks okay on the undersurface. It looks okay on the top. Then what I do is I sneak it in way to the back here, being careful not to damage anything. And my trusty assistant, Laurie, helps me out here. She's holding the leg for me while I slide the camera deep over here and look at the back of the meniscus. It looks beautiful. Take a picture of that. And then I pull my camera back. I put the knee down. And then I go into the back of the knee to check the posterior horn. That looks beautiful. I check the PCL to my right. That looks perfect. I go even farther in. And we look for loose bodies because, like I said before, plicas are right. And then I back the scope up again. I look at the ACL. Let me wash the joint out a little bit more. ACL. Let's just get that blood out of there so we can see better. There we go. ACL. And then the last thing we look at is the lateral compartment. That means I look at the lateral side of the knee. That's the outer side of the knee. And then that's a beautiful view right there of the lateral meniscus. The root of the lateral meniscus looks fine. The body of the lateral meniscus looks fine. Anterior horn of the lateral meniscus looks fine. Rotate my scope all the way around. ACL, you can see the posterior lateral bundle looks fine. And then what I do is I slowly extend the knee to make sure that I'm not missing anything. Okay, the lateral condyle looks beautiful. And then I come back around this way and I do a final check lateral side because there was some pain on the lateral side, but there's nothing actually on the lateral side. But what I want to do now is slide my camera on the other portal and just make sure that there isn't shave piece. So there's a little bit of synovial tissue that I'll shave, and then that'll be it.